to the Ashanti Regional Capital, where the Komfo Teaching Hospital has launched a new remedy to deal with stroke cases. This comes, as I said, it admits over 1,000 stroke patients every year. That's quite, frightening. A figure in contrast to some 200 cases recorded 40 years ago. Clinton Yeboah reports the hospital is resorting to time-bound and minimally damaged treatment to improve stroke treatment.
A decreased blood flow stroke occurs when the blood supply to parts of the brain is blocked or reduced by a blood clot. Stroke has been noted as the top rampant medical condition being recorded in the Komfo Teaching Hospital. Treatment remains a challenge. While experts explore contemporary treatment methods, the drugs and medication previously used in stroke treatment did not dissolve blood clots, hence leaving patients with a permanent disability. Active stroke thrombolysis will administer clot-busting drugs and medication to dissolve blood clots in the brain. During an acute stroke, thrombolysis services will incorporate thrombolysis into routine stroke care at Komfo Teaching Hospital. At the launch of the implementation of thrombolysis services, consultant neurologist at the Komfo Teaching Hospital, Dr. Fred Stephen Safo, said the new method is revolutionary.
In the past, when somebody had a stroke, what we used to do was you admit the person and start aspirin. But those drugs in the past does not dissolve the clot that has been formed. And so the person will have a permanent disability. But in this intervention, the clot, which is the problem, the one that is causing the symptoms, is what you are dissolving from the brain so that the person will be healed and the person will be cured, in essence. So it is revolutionary in that it is novel, it is innovative, and it can really improve outcomes for our patients.
Chief Executive of the Komfo Teaching Hospital, Professor Ochiri Adei Mensah, says the hospital's new strategy is to optimize the delivery of tertiary health care.
Distinguished ladies and gentlemen, regrettably, challenges such as limited access to healthcare services, especially in the rural areas, low public awareness about the risk factors, symptoms and prevention of the disease, as well as shortage of specialized healthcare professionals skilled in the management of stroke cases, have undermined the prevention, diagnosis and treatment of the condition in the country. In line with the hospital's new strategy to optimize the delivery of tertiary healthcare through innovation and research, management has supported the KATH multidisciplinary stroke thrombolysis team to commence the delivery of the special service to save stroke patients brought in time to this hospital from suffering the worst possible impact of the disease.
Deputy Regional Director of Clinic Care, Ghana Health Service, Rita Larson Randolph, is enjoining stakeholders to heighten public education on stroke.
I would just say that we are happy this is happening. We are ready to support, but immediate term, what we think that as a service we can do is with the awareness creation and educating people to suspect so that they report to you, the experts. And then we will call for the material, what exactly to say in educating the people, because you have the expertise. So we believe that for the immediate term, that is something that is a service in the region we can do to support this novel thing that has come.
Reporting for Joy News, Clinton.
Right, so the situation at the Komfo Teaching Hospital is coming on the back of several reported by other health facilities. So what really is going on? We've been looking at the figures and the numbers regarding stroke, and if this is what we have. So some leading causes of stroke: hypertension, alcoholism, diabetes, high cholesterol, tobacco use, secondhand smoke. I mean, these are some of the causes that we know. Now, over 78% of persons affected with stroke are not able to access post-discharge support, neither are they able to afford the cost for the treatment of stroke. And if you are looking at Komfo statistics, that's quite alarming. Stroke has been identified as the #1 cause of death at the Eastern Regional Hospital 2023. And our Komfo is also reporting almost same with numbers that quite, makes one uncomfortable. Now, 50 million people worldwide suffer from stroke annually. That's on a yearly basis. Of these, 5 million die another 5 million are left permanently disabled. That's, you know, the effects of what you get if you are unable to treat it the way it's supposed to be. And whether or not you can permanently get out of it, that's another issue that we'll be discussing here in the studio. As you go and have your exciting weekend, you should always have at the back of your mind some of the things that, you know, human activities can contribute to, you know, bringing it to reality. So this is what we'll be doing this afternoon here on The Pulse. And I'm privileged to be joined by a very good friend, Dr. Josephine. You're welcome.
Thank you.
A way to meet. All right. So, I mean, we've been looking at the figures coming from Confanoche. In the last few years, from 100 to now 500. I mean, why? What really is happening that we are reporting so many stroke cases across the country?
So when it comes to stroke, we don't have causes per se, we have risk factors. So the fact that we have risk factors, as you already listed, you know, on the screen, it means that most people are now at risk of stroke, and we are also diagnosing more. Because, you know, years back, people were not having access to health facilities like they have right now. So we're not catching most of the cases. Now, people too are now living much better lifestyle. People are indulging in alcohol the more. People are, you know, not really taking care of their diet like they used to, because now they have access to all sorts of foods instead of the healthier ones that we used to have back in the days. So when you look at the risk factors, it's usually related to lifestyle a lot, okay, and the way we take care of ourselves. So now it tells us why it's on the rise, and also it's also because we are also diagnosing more.
So basically lifestyle, nothing beyond lifestyle, or there could be issues of hereditary.
We have so the risk factors, when we take hypertension, diabetes, all these ones have genetic link to it. So some people are hypertensive just because they have the genetic predisposition to being hypertensive. Some people are diabetic because genetically, you know, it predisposes them. But aside that, our health, you know, the way we eat, alcohol, smoking, if we don't eat too well, although we have genetic components of cholesterol, you also, you know, get high cholesterol level from poor diet. And all these things can also cause you to get diabetes, and it can make you also get hypertension as well. So it is intertwined. There's a genetic role, there's lifestyle role, and all these things coming together increases the, you know, the chance of getting a stroke.
So Dr. Famaya, is everyone at risk, or this is for a certain segment of the age bracket?
I think everybody is at risk. That is if you don't take very good care of yourself. Because you see, the risk factors for stroke are not limited to what we saw right now. There are more to it. Like if you take migraines, it can even give you stroke.
Really?
When you have like carotid stenosis, narrowing in some of your vessels in the neck, you can have it. If something like homocystinemia, you can have it. Sickle cell in children can cause stroke. So what we listed is not the only cause of stroke. There are other causes of stroke that are less common. But these ones are the dominant ones that we see most of the time. We have lots of people having hypertension, but not all of them are having stroke. Lots of people having diabetes. So it's neither here nor there. They are not direct causes. But since we are at risk of having these diseases, then we are at risk of having stroke as well.
Let me bring in the former medical director of the Greater Accra Regional Hospital, Dr. Thomas Winsome Anaba. Dr. Anaba, you're welcome to The Pulse here on Joy News.
Thank you. Good afternoon to you and to your cherished viewers and listeners and your panelists in the studio.
So the question is, are we blowing this out of proportion, or this is a real danger that we must take some serious view of?
Can you repeat your question? I am currently in a rural community. The network is not very good, but if you could repeat your question.
Right, so Dr. Anaba, I was asking whether we are blowing this stroke issue out of proportion, or this is something that we must take serious view of.
Not at all, not at all. We are not blowing it out of proportion. It seems from the statistics, we can see that hypertension, stroke, and then heart attacks are rising in Ghana. This is because non-communicable diseases are becoming now predominant more than infectious diseases, meaning that, like the doctor just finished elucidating some of the factors, we are not doing so well when it's coming to managing some of these things. People don't want to change their lifestyle. We're rather adopting very bad lifestyle that would cause more harm to us and intensify the occurrence of strokes and heart attacks and hypertension and diabetes. Looking at our daily activities alone, somebody gets up in the morning, wants to go to work from KATH to Accra. He sits in a car. He gets to work. He's stressed. He comes back he's going back to the house. He takes another 3 hours sitting in a car. Gets home. He's stressed up. Problems in the house. He doesn't eat well, and he doesn't do any exercise. At the end, even from dropping from the throttle, he takes another yellow to his house, meaning that he doesn't do any exercise. The only thing is sitting in a car, 3 hours to go to work, in and out, sitting at the office and then the rest. What we eat. Now we see these sugary drinks being sold everywhere in the country. The young chaps taking what they call caffeine drinks, energy drinks all the time. And people who are prone to have that hypertension, even have family members with hypertension, do not even know that some of these things are causing risk to them to trigger their hypertension and then the rest. You get, let's say, children taking drinks that the sugar content in it alone would cause them more trouble, would cause them dehydration. All this would lead to hypertension and will lead to heart failures, will lead to strokes in them. There are some others too, they take some herbal concoctions. We see it a lot here in the north. They prefer to take herbal medications and believe in prayers, pastors, juju people to help them treat their hypertension, other than taking even hypertensive medication and following guidelines and protocols that would help them eat healthy, good food and live well. And they end up coming with strokes and so many other complicated diseases like renal failures that would even lead them to hypertension and strokes. And worst of it all, you see people eating food that has been prescribed as medicine for them. Brown gold. Ghanaians, we are seeing it a lot. Brown gold. Oh, I'm taking brown gold. I don't no longer take hypertensive medicine. Some of these, we are not educating them very well, and they are not also listening very well. And the few that should understand better are not even doing it. I get more stroke patients who are well educated than even the illiterates who come to my hospital. Meaning that there is something wrong. Meaning that the system, the culture, the society is not playing a positive role in managing patients, in managing the society not to get hypertension and its complications.
So, Dr. Anaba, when you spoke about the sugary drinks, I mean, you kept mentioning children. Does it mean that children are also at risk?
Look, they are at risk. I see a child, a small chap, drinking a bottle of Coca-Cola who is just about 5 years. What does it mean? That is about 6 cubes of sugar. And he will not drink only one. He will drink one. Later on, he will drink another one. And you don't just know what they are doing. And parents are naive about it. And they think that the child wants it, so we give it to him. Even adults. I've seen an adult taking, at a go, 2 what do they call it, this energy drink. 2 at a go. With a lot of caffeine in it. This will trigger you to get high blood pressure. And they don't drink it only one day. They drink it almost every day. So our lifestyle, like the doctor said, is one of the main causes of hypertension and its related complications in our society. People don't also exercise. The stress levels in the country due to hardship, challenges at work, at home, economic, and in the rest is also contributing factor to it. People not even able to sleep well because somebody has to wake up around 3 o'clock to bath and prepare and take a car around 5 o'clock before he gets to his workplace and then the rest. And some other communities, they don't just have a doctor to attend to them. Let me say that. I know of communities, hardly did I get a doctor. If you ask for somebody, what was the last time you measured your blood pressure? He'll tell you he doesn't even know what blood pressure is because they don't have a doctor, they don't have a nurse that will go around measuring their BP. So we have cheap compounds, but the nurses perhaps don't even have the equipment to go around to do that unless you go to the hospital. So we are not even searching for the people. We are not educating them well, and some of them would fall to these complications of hypertension and diabetes.
Dr. Anaba, let me ask a final question so that I can let you go. So what do you suggest should be the way forward? Especially now that we are seeing so many reported cases of stroke. Now these are the hospital figures. That is quite frightening.
It's frightening. We need what we call public education. I think what we have in Ghana is advocacy. We've done a lot of advocacy. What we now need is education. Education means that we have to embed this into some of the teachings we do in our churches. Maybe you have a doctor in your church, he comes one Sunday, you give him some 30 minutes to talk about certain diseases to the public and then the rest, to demystify some of the things that they fear about hypertension, especially men. They fear to take hypertension medicine because they say they will become impotent.
Yes.
That is not true. It depends on your hypertension, the type of drug that you need, and there are ways to help you be potent when you are taking antihypertensives. Some of these educations need to be drummed into their ears severally so that they understand.
Thank you very much.
That way we will minimize the complications of hypertension.
Well, thank you very much, Dr. Thomas Anaba, formerly with the Greater Accra Regional Hospital. Let me come back to the studio. Dr. Josephine Awochukwueno is still here. So, Doctor, a few things that I'm learning for the first time. Sugary drinks, energy drinks are all contributory factors. How? I mean, you are giving a sugary drink to a 5-year-old, and then there's risks attached to it.
So initially, I was talking about lifestyle. See, if you look at the kids of today, we have lots of childhood obesity, and it's stemming from the kind of things they are consuming. So the kids are taking lots of sugar, they are taking lots of fries, lots of fatty, foods. It makes them obese, and then this puts them at risk of developing diabetes and hypertension.
So therefore, for adults, it's a no. Is that what you are suggesting?
So it's about moderation. I wouldn't say don't do it at all. But it's about moderation. You should know when to and when not to. The quantity, the amount, the times. The fact that he or she is a 5-year-old doesn't mean the child is entitled to everything that is available. The fact that you love your child doesn't mean that whatever the child wants, you should give to the child. Because you put the child at risk, then 5 years, 10 years later, then the child starts battling with all sorts of things. You wouldn't know that it was because of what you did when he or she was younger, but then that could be the cause.
But again, a lot of people are walking around not even knowing whether their BP is high or is low. In fact, medical checkup is almost alien in this country, and that for me is a foundation to the discussion we are having.
For me, I think education, ignorance is the thing, because the medical checkup is not, really working because people are not educated, people are not aware. Okay, so first and foremost, we need to educate them. If people get to understand they need to do certain things, then they will do it. People don't do it because they don't understand and they don't appreciate it. But then, so I think we should start from education. If you're able to sensitize them, for them to realize that there is a need for that, then we can push them to go further and go get checked. And then we should also put down certain avenues to make it easy for people to get checked.
So for those who may not know their body index and maybe walking around thinking that everything is well with them because they don't have headache, they think that everything is fine, and the next morning you hear another person collapse and then heart stroke. There are a lot of people around. There's so many stories that we hear of them. What should be the first step in terms of taking care of your body?
Okay, so aside getting to learn how to take care of yourself, I think everybody should at least once a year get a full check.
4 times in a year?
Once a year,
okay.
At least. I think that one, for once a year, we should be able to afford it. Based on wherever you find yourself, getting your blood pressure checked, your sugar level, few things, getting your BMI, and then the basic ones. We are not saying push forward to do extra laps if you can't afford it, but the basic things like your blood pressure, your sugar levels, and even if not at all, at least once a year.
And when you do that, what should you look out for in terms of guiding you going forward?
So we have guidelines, okay? So we have certain values that you shouldn't go beyond it. So now based on when we check, when you are within range, we will let you know. If you are just above or you are you're in the danger zone, we will let you know. That's what education also comes in. Because if you know what is the normal, then the moment you go beyond normal, you get to know. Even with the blood pressure, our pharmacies are checking it. I mean, for 5 cedis, 10 cedi, you can go to the pharmacy and get your blood pressure checked. So even without going to the hospital, you can just badge maybe every 3 months to say that, let me get my blood pressure. Because one of the things that's also causing hypertension is stress. We are stressed.
Yeah, of course, especially here in Accra.
Yes, we are stressed. So we should also try and get it checked. You don't even have to go to the hospital. Even the pharmacy near your house, they can even check for you. They can even check your sugar level for you if you don't have the money to go through the whole process of going to the hospital. Now, if you get to learn about it, then the moment you check, you know whether you are in the danger zone or not, if you have to see a doctor or not. There are certain things that we should see it as basic, okay, so that we don't have to get to, the very bad level before we rush to the hospital when it's too late.
And then tomorrow is Saturday. I'm sure a lot of people will go to Peduasi and then do that usual jogging. Is that enough?
You see, if it's just actually,
and then after they come and eat the watch and the stuff.
Then we nullify the effects
Exactly.
of the exercise. Exercise is very good, and I mean, averagely, it's advocated that you do it 3 times a week. That is when we can say that you're actually exercising. And if we're exercising, it doesn't give you the licenses to do anything you want. The fact that you're exercising doesn't mean you can drink anyhow, you can eat anyhow. You see, it goes hand in hand for you to have a healthy lifestyle. So a bit of exercise, your diet, having enough rest, sleeping well, all comes together. It's a package. Because if you do one and you don't do the other, you sort of end up nullifying the effects of what you are doing.
And then, but would you recommend that if I don't know the state that my body is in, and I'm hearing you for the very first time, I should just say that because we are talking about exercise, I should just, for example, start tomorrow and start exercising?
No. You see, there are some people, they have certain health condition that may not allow them to do certain exercises. Okay, so we are all not the same. You should know your baseline, how fit you are, before you can do certain exercises. So sometimes we actually have exercise consultants. I mean, they are not common in Ghana, but when you go to the gyms and all that, some of them have trained people, and you should also get to see your doctor to find out you don't have any comorbid condition. When I say comorbid condition, you don't have any hidden disease that you don't even know of. And if you know you have any disease, you should let your doctor know, so that you know the level. Everybody can exercise, but you should know the extent, the kind of exercise you can do, so that you don't end up causing more harm than good.
Because I understand that, I mean, some exercise can actually be of a disadvantage to you, especially if you don't know that you are hypertensive and you just go under the meter and start lifting and all these
Exactly. So you cannot just hit the gym or start running when you don't know your baseline, your underlying diseases, or the extent to which you can go. And even if you are exercising, you build it bit by bit. That's why you usually need a trainer, because when you are starting and you just zoom in, you can actually hurt yourself. So you have to start bit by bit and grow gradually in the process. But I mean, small jogging here and there
will help.
Yes.
One key matter that is of concern to a lot of men, and a lot of men who are hypertensive and they are refusing to take their drugs, and the excuse is that it reduces their potency. Is that scientifically proved?
So we have different kinds of antihypertensives. We have different groups of medication, and they all have, based on how they work on the body, they have their own peculiar side effects. Okay, so what would work for you wouldn't work for somebody else. So when you are diagnosed of hypertension, we look at your age, we look at how bad the BPs are, we look at your other comorbidities to determine what would work for you. And when you start taking a medication and you think it is not working on you, you're supposed to come back to the doctor
for them to change for you.
To change for you, because something else would work for you. There's always one that would work for you. Okay, so what they are saying is not right. We have different groups of medication. Okay, so if you are taking a particular medication which is not working, just go back to your doctor. They will change it for you.
But hypertension drug doesn't cause impotency?
No.
All right, doctor, before you go, your final words to our viewers.
Okay, so what I would like to say is we are all at risk. There are several things that put us at risk of getting stroke, and nobody is exempt from it. However, we should take very good care of ourselves. And if you know you have any of these risk factors like was put on the screen earlier on, then please make sure that you get it controlled. If you're hypertensive, get it under control. Take your medication. If you are diabetic, do that. Make sure if you are drinking, drink religiously. If you are smoking, smoke religiously. As I wouldn't say stop if you can't, but do it in moderation. Please, let's take care of ourselves. Let's try and go to the hospital. Let's get checked at least once a year. And then I think we can. You will be fine. You'll be fine. But you also do these tips on some of your blogs, and of course you enjoy this. Yes. Tell me a little bit about it. Okay, so I call it the TDJ Show, Time with Dr. Josephine. Now we have a new account. We had an old account that we had issues with. The new account is the TDJ Show 120. So on Instagram, Facebook, and YouTube. We talk about all these things. There's a video on stroke, on diabetes, hypertension. Please do well, visit and then listen. And I think it will help all of
You're
us.
also the host of our new show, Health and Vitality.
Yes.
Also tell us about it.
Okay, so it's also giving snippets of health education. I'll be coming on your screen every day to talk about something, you know, concerning your health. So please stay tuned. Don't miss any of our episodes. Dr.
Josephine Awochikweno has been my guest. Thank you very much for
You're
coming
welcome.
through. This is the Pulse here on Joy News. And